Well, good afternoon, everybody. Thanks so much for joining us today. My name is Greg Olson. I'm the director of the New York State Office for Aging. Let me ask you a question. How would you like to put over $7,000 back in your pocket? Today, you're going to find out how and potentially save even more money by making informed decisions during the Medicare open enrollment period, which is about to begin. But first, let's set the groundwork. Take a look at this.
The Medicare Savings Program, or MSP, could save you up to $7,000 annually. Hi, I'm Heather Leddick with New York's Health Insurance Information, Counseling, and Assistance Program, also known as HIICAP, here at the New York State Office for the Aging. New York State recently expanded the MSP to include higher income limits in 2023. What does this mean? You and approximately 300,000 other New Yorkers may be newly eligible for this assistance right now. If your income falls within the levels on your screen, please apply today. If your income is just above these numbers, still consider applying. You may be paying for out-of-pocket costs that can be deducted from your gross income to make you eligible. Free, objective, statewide assistance is also available to help you in the application process through HIICAP. Simply call the statewide helpline at 1-800-701-0501.
Thank you so much, Heather. If you haven't seen Heather around the internet, on YouTube, etc., then I don't know where you've been, because she's been everywhere. It's that time of year again. It's amazing how fast it comes. October 15th begins the Medicare open enrollment period. And that's the time when Medicare beneficiaries can make changes to their health plan, their prescription drug coverage, and also exercise other options. It's also time to get assistance enrolling in the Medicare Savings Program, which we just heard Heather mention. And we're going to be talking about these and other opportunities with our guests today. We're really proud in New York State that we have something called the Health Insurance Information, Counseling, and Assistance Program. It's often referred to as HIICAP. It provides free and objective counseling to older adults during an open enrollment. And I really want to hone in on the free and objective, because it's really important. I guarantee you, no doubt, you're already being inundated by mailers to your house from health plans. The television commercials are going to be, wild and often of folks trying to get you to call those numbers so that you get their plans. And what we want to make sure that you walk away with is, don't call those numbers, call the HIICAP program. And we have another special guest with us from the Medicare Rights Center, because the objectivity is extraordinarily important. We're not selling a product. We're selling objective information so that older adults can make the best choices for them, not leading to a phone call that's going to sell a particular product. So it's really, really important. HIICAP reaches over 200,000 beneficiaries every year. And last year, HIICAP assisted 24,383 individuals with the process of enrolling in MSP, or the Medicare Savings Program, saving low-income Medicare beneficiaries an estimated $170 million. In one analysis, HIICAP counseling was also shown to reduce hospitalizations by 54%. That's a project out of Monroe County that they've been doing for over a decade, and reducing emergency room visits, hospitalizations, and observation status. This program is extraordinarily successful, in large part for the network across the state, the staff here at the State Office for Aging, but really under the leadership of Heather Leddick. So Heather has a very busy period coming up. There she is right there. And we greatly appreciate her joining us, sharing her expertise with us, talk about how the HIICAP program can help you and anybody else that you know. We also have a fantastic friend and a long-term partner from the Medicare Rights Center, Fred Riccardi. There's Fred right there. Welcome, Fred. For over a decade, Fred has been a lead Medicare advocate nationally, helping Medicare beneficiaries and families access and afford their care, and advising professionals on how to better serve their clients. He has collaborated with an array of stakeholders to help inform federal and state healthcare policy, and as a frequent spokesperson on Medicare issues in major media outlets. He's going to talk more specifically about the Medicare Savings Program and some of the challenges in store for 2025. So Heather and Fred, welcome to the show, or I should say, welcome back.
Thanks, Greg.
So Heather, let's start with you. Talk a little bit more about HIICAP.
So as you mentioned, HIICAP is the Health Insurance Information Counseling and Assistance Program. What we do is we're helping Medicare beneficiaries, but not just Medicare beneficiaries. We're also working with people who have Medicare and Medicaid. Those are referred to as our dual eligible population. We're helping them navigate and find a plan that's right for them. We're also working and getting folks enrolled in prescription drug coverage, helping with Medigap supplemental plans, an array of different things. Most importantly, as you already mentioned, we are providing free objective information. So HIICAP, is available. You can contact 1-800-701-0501 and be connected to a counselor right in your local area that's going to be able to meet with you and provide one-on-one counseling.
That's awesome. So I'm going to ask you to repeat the number again. And is there another way if somebody doesn't want to call the number, local places that they can go, one-on-one visits in person, so the variety of options of how clients can find HIICAP?
Yeah, so the number again is 1-800-701-0501. And of course, HIICAP is meeting with folks at local libraries. They're meeting with them at the local area agency on aging, the Office for the Aging. And we also are working with our partners, just like Fred at the Medicare Rate Center, one of our partners through our MCAPs, and working with them to help assist beneficiaries across the state and make sure that they're receiving that important counseling this open enrollment period.
That's awesome. Talk a little bit about the HIICAP helpline. Now, who can benefit from calling that?
So anybody who has Medicare, so that is Medicare based off of your age, meaning you've turned 65 and you're recently enrolled in Medicare. Medicare based off of disability, so that's somebody who maybe was collecting Social Security disability benefits, and through those disability benefits, they were automatically enrolled in Medicare, or somebody who has end-stage renal disease and they obtained their Medicare that way. So anybody who has Medicare can benefit from calling HIICAP and just sitting with a counselor, whether you're new to Medicare or whether you're looking to see what changes are ahead for 2025, you would benefit from contacting a counselor.
Oh, that's great. Alex, I'm going to ask you to put that phone number back up. And I want to make the point again. The folks that are in the HIICAP network are state certified every single year. They're experts on the plan comparisons, the things that both Fred and Heather are going to talk about. We are not selling anything. We're selling objective information so that you can make the best choice for you. So don't call the number on the television screen. Call that number. Fred, let's shift over to you. We've been talking a lot about the Medicare Savings Program over the last, couple of months or year. I think that you can never talk too much about it because there's still, while a lot of people are utilizing this great benefit and it was expanded here in New York, there's still a lot of people that are eligible for it. So can you talk about the Medicare Savings Program?
Sure, Greg. MSP, or the Medicare Savings Program, is one of my favorite topics to talk about. If you would have told me 20 years ago that I would be focused on this benefit for 2 decades, I would first ask you, well, what is MSP? I don't really know anything about it. But this program, and I love this program, is so important because what it does is it helps older adults and people with disabilities who are on Medicare afford their Medicare premiums, and it also lowers the cost of their prescription drugs. I also love Medicare, but we know that Medicare has gaps in coverage, and for some people, it's just not affordable. If you start to add up the premiums, your Part B premium, your Medigap premium, your Part D premium, you're looking at about $5,000 a year in premiums alone. And we know that so many people are living on very limited incomes. And that's why we all came together, we worked together, and we expanded this benefit to help more people throughout New York State. So if someone is a single person and their income is about $2,400 a month, or as a couple about $3,200 a month, they may be eligible to have their Part B premiums paid for every month by putting that money back in their Social Security check, and also have the cost of their drugs lowered. But even if your income is higher than that, a person may still be eligible because income is counted differently, say if somebody's still working, etc. So just to kind of put a dollar amount on this, we're approaching nearly 1 million people in New York State enrolled in the Medicare Savings Program. That means every year, I think it's close to $2 billion is going directly into people's Social Security checks. And we still have a few 100,000 people eligible in the state. So what we're trying to do, partnering with HIICAP, is get the word out about this benefit and just be screened for it because you may be eligible. Don't count yourself out until you've been screened for the benefit.
Yeah, and I'm glad you said that. And I really want to reiterate. So you said it's around 2,400, but if you're in the 25, 26, there may be deductions to get you down below that level. So Fred's point is really important. Don't count yourself out. Get screened, and you might be surprised. So don't self-select out. Fred, how do people go about applying for MSP if they might believe that they're eligible, as we're encouraging people to do?
Yeah, so there's a few different ways. Well, first you can call HIICAP, you can call the Medicare Rights Center, and we can screen you for the benefit and we can help you apply. The applications themselves are administered through the local Department of Social Services. You may know it as the Medicaid office, or if you're in New York City, that's the Human Resources Administration. Those applications can be mailed in, they can be dropped off, or you can work with a certified agency like the Medicare Rights Center, and we can submit those on your behalf. The MSP application is not online yet. You can't apply online, but we're hoping in the next couple of years that's going to be available online too.
Yeah, I hope so as well. Heather, to say that this process, which was created as part of the 2005 Medicare Modernization Act, is confusing would be an understatement. People, are probably wondering every day you go to the mailbox, if you're a certain age, you're getting tons of information from all kinds of different plans. They might be wondering, why am I getting this information about enrolling, et cetera, et cetera? What do you say to that?
Yeah, people are getting inundated, whether it be phone calls, whether it be mailers, they're being sent information on all of the plan options, and it's just overwhelming. And what I say about that is, don't pick up the phone and call the number you saw on that commercial. Again, you need to call us so that we can sit down and provide that one-on-one counseling assistance. I always like to share a story. A few years ago, maybe 2 years ago, we had a beneficiary who did call the number on one of those commercials she saw on TV. And she was enrolled into a Medicare Advantage plan. And unfortunately, she lost her federal health benefits that were her retiree benefits that she had worked for many, many years to obtain. Luckily, the family contacted us and we were able to turn things around and get her back into those federal retiree benefits and get her out of that Medicare Advantage plan. It is really important before you call a number or reply to a flyer to give us a call, and we can just do a level set, let you know what you currently have, what things look like, what's upcoming for the new year, and what changes are taking place.
I mean, that story is amazing. I mean, that's a real life impact of what this marketing looks like, but the ability of you and your team and others throughout New York State, the Medicare Rights Center, some of our other partners. I mean, this stuff really matters. So I'm going to ask you a couple questions, Heather. When is the open enrollment period begin and end? What happens if you do nothing? And I want just on a personal level, and again, I want to give Heather all the kudos in the world. One of her clients is my dad and his wife, who, there's some changes in my father's circumstances that required a really in-depth analysis of some plans, and Heather is doing that. That's how important this stuff is. So when is the open enrollment period begin and end, and what happens if you do nothing?
Great question. So October 15th to December 7th is the Medicare open enrollment period. What can you do during that period? You can make a change in your coverage. That is your time to sit down, evaluate what's changed with your own personal health and what is going to be the best option for you in 2025, whether it be Medicare Advantage, Medigap Supplemental, or prescription drug plan. If you do nothing, you will end up with the same coverage you have as long as that plan is going to continue in 2025. And I mention that because more and more we are seeing plans that we are referring, they're not renewing, meaning they will no longer be offering coverage in January of 2025. We have quite a few Medicare Advantage plans that will be ending, not renewing particular plans under their umbrella. And if you do nothing, then you could potentially not have any coverage January 1st, 2025. If you do have a plan and it is renewing for 2025 and you do nothing, then you would just remain in that plan. But again, their prescription drug formulary might have changed on that plan, and it might not be the best plan for you, for your personal health needs and your prescription drug needs.
So, I mean, it's really important. So if your plan is not part of the 2025 and January rolls around and you did nothing, you would have to wait an entire year then to re-enroll or October through the next open enrollment period, and you'd be without health insurance for 10 months.
It depends on your circumstances. And of course, there are some special enrollment periods where we can help folks if they've missed their opportunity. We do have special enrollment periods, and we can work with the beneficiary to make sure they definitely have coverage. I want to mention one other important thing is last year in 2024 in New York State, we had 15 Medicare prescription drug plans. This year for 2025, we will have 12 Medicare prescription drug plans. So right there, you see that 3 plans are off the table. So we've got to work with those beneficiaries and make sure we get them in a plan for January 1st. But for some reason, if you miss the deadline, still give us a call. There are special enrollment periods that we will be able to help and try to help you get enrolled into the correct plan that works for you for 2025.
Great advice. Fred, insurance is complicated. We all get these big books, right? I don't know how many people read them or don't read them. But even understanding the difference between Medicare, Medicaid, most people don't know what those are. What's the difference between traditional Medicare or original Medicare versus a Medicare Advantage plan?
So there's a big difference. And a little known, fact about original Medicare and Medicare Advantage is that someone still retains their Medicare coverage. So original Medicare is your traditional program where it's administered by the federal government. You have your Part A, your Part B, your hospital benefit, pays for doctor services, etc. And there are out-of-pocket costs. Generally, you pay about 20% of a fixed amount for an outpatient service. Medicare Advantage combines everything, but it's provided through a private health insurance company. So you may hear of Humana, United, Excelis, etc. And a person has to follow the rules of the Medicare Advantage plan they're enrolled in. There are provider networks. You may have to ask for permission to have a service or to see a specialist. And so it's really important to look at those details. Some Medicare Advantage plans offer extra benefits like a limited vision or a dental benefit, etc. But it's really important to look at those details. What's terrific about HIICAP is that not only do you get to speak to a kind and compassionate counselor who's ready to help you, you know that person is going to be independent and fair and do their research into what plan makes the most sense for an individual. They're not earning a commission, they're not getting a royalty year after year because someone enrolled in a certain plan. So that's a big difference also using a HIICAP counselor versus an insurance broker. So it's really important to kind of ask some of those questions if someone's going to try to work with anybody around their Medicare coverage options.
Yeah, great. Thank you. And what are some of the changes people can expect to see in 2025?
So there are some big changes. And I was really encouraged this summer. I spent a week up in the Adirondacks, and let's just say there weren't that many people around. So I kind of found myself hanging out at the Stewart's a little longer than I normally would just to chat with people. And I had this great conversation at a picnic table with a couple of guys, older guys on Medicare, and they finally had heard about what was happening with Medicare Part D coverage in 2025. Folks, you may have heard of something called the Inflation Reduction Act. A major part of the Inflation Reduction Act has focused around prescription drug affordability for people enrolled in Medicare. And there's some big changes. Some of them have already gone into effect, but I want to talk about what's happening next year. Next year, there's going to be a cap on out-of-pocket costs in Medicare Part D. Those are your co-payments or your co-insurance that you're paying for your prescription drugs. And that cap is going to be $2,000 for the year. Previously, and Heather, you remember this, and Greg, you remember this, people would call us complaining about something called the donut hole. And the donut hole is not some tasty treat. It was the period of time in Part D where someone would have to spend thousands of dollars out of pocket before the health insurance company, the Part D plan, would kick in and pay for that prescription drug. That's gone. Next year, there's going to be a $2,000 cap, and people are also going to have the opportunity to spread those costs across every month. So let me just give like one real life example. Last year, we spoke to someone who's taking a drug for a retail cost of $412,000. This person needed this drug to be able to live and stay healthy. And this year they got some relief from the Inflation Reduction Act, and they were limited in about $3,500 across the year for their prescription drug. The year before, they had spent about $12,000 for that drug. Next year, it's going to be capped at $2,000. So it's really important that people know this change is happening, because it's going to provide relief to people who have chronic conditions, need to take an unexpected brand name drug, et cetera. So we're really excited about that. But we also have free vaccines as part of the Inflation Reduction Act. And we also have just an easier way of kind of paying for your prescription drugs throughout the year.
I think that's amazing. And I'm trying to think of where you were in the Adirondacks, because I know it well, and all the Stewarts, but I know
Indian
exactly.
Lake, up in Indian Lake.
There you go. I know exactly, the folks that you're going to see up there are primarily older, and it's great that the messaging about some of the prescriptions, insulin caps, et cetera, are reaching people, because it's hard to reach people. Before I move into the next break, are there any questions that I didn't ask you, or points that you either want to make that I haven't raised, or you want to reiterate something that you've already said? Because this is so important and timely, and people really have to take action and make sure that they get to the place where they can trust the information that they're getting back.
If there's one thing I could say is we are in the open enrollment period, October 15th to December 7th. So don't wait to make that call to us. Give yourself time so that you can digest the information, and we go over everything, including what Fred just shared with the $2,000 cap and a lot of the good things that were made available through the Inflation Reduction Act. So don't wait to the end. Give us a call now. We have counselors standing by, ready to help.
Yeah, and Greg, I just wanted to mention, as the new year rolls around, if someone does have a problem or experiences some trouble with their Part D plan or their Medicare Advantage plan, they should give HIICAP or the Medicare Right Center a call, because there may be something that we can do to fix that. And so we help people appeal for drug coverage. We help resolve health service denials from MA plans. So these services are available throughout the year.
And I'm really glad you said that, because you guys are going into this intense period, but come January, it's not like you're off again until October. You're working, every day during the week. So I'm glad that you mentioned that. So if you're just joining us, we're talking with Heather Leddick from the HIICAP program and her friend Fred Riccardi from the Medicare Right Center about the Medicare open enrollment period, some of the new changes, and really focusing in on, reaching out to an objective counselor through either of our networks and some of our other partners. We're going to be taking some audience questions soon, because I know this is a hot topic. But first, I want to let you know that New York State, we oversee the largest nutrition program in the country for older adults. And this program is made possible in large part thanks to the volunteers. We have almost 1 million volunteers in New York, providing 495 million hours of service at an economic value of $13.8 billion. Our nutrition program, both in the congregate and home delivered meal setting, relies on volunteers to prepare meals, deliver meals, staff the senior centers. So take a look at this. So if you're wondering, are those really what the meals look like? The answer to that is absolutely. And I want to thank LifePath in Albany for the footage that we joined there through the March for Meals program, and then some of the others around the state. I've been fortunate to be eating these meals for about 33 years, and I got to be honest with you, I've never had a bad one. So Alex, I think we got some questions from the audience. And again, want to thank all the volunteers, not only in that program, but the HIICAP program, LitCop, all of aging, and the many, many thousands of not-for-profits that older adults help stand up every single day. I see many ads on TV about various plans. How do I know if they're legitimate or if they're scams?
So yeah, the ads that you're seeing on TV, of course, we're seeing a huge uptick right now during the open enrollment period. Many of those are legitimate ads from insurance companies that are offering Medicare Advantage products. But the best thing to do, again, is just to reach out to us. I can't say that enough because we are providing that free objective information. So rather than calling the plan and risking, something happening and you get enrolled into a plan that's not working for you, or your providers don't accept that plan, or your prescription drugs aren't on the formulary, the best thing to do, again, is to pick up the phone and to call one of our trained counselors.
Agreed.
Greg, I want to mention, you might hear some sirens behind me, and essentially there should be a little flag or a little siren that goes off if somebody's feeling pressured into enrolling into a new health insurance product, whether it's a Medicare Advantage plan or a different Medicare Advantage plan or a supplement plan. So people should really step back and give some time to think about it and make sure they talk with other people, talk with family members before making these big decisions, because it can really disrupt the way someone receives their care.
Yeah. And also I'll say, I talk to beneficiaries every day. And again, this is a program that is a year-round program, not just during open enrollment. And, in talking to beneficiaries, sometimes they'll call and they say, I want the plan my friend has. I want the plan my neighbor has. And I say, well, you're not your friend and you're not your neighbor and your healthcare needs are different. So let's talk about it.
Yeah, I think fantastic advice. Next question, are there other times of the year that I can enroll in a Medicare or program? So you guys talked a bunch about MSP, QI1, et cetera, Medigap. So the question was, are there other times a year you can apply for Medicare and other options?
So there's a few things. I mean, first, New York is a great place to grow old in my opinion, because we have so many different programs. We have the most generous Medicaid program in the country for older adults and people with disabilities. We have the MSP. We have a program that helps lower the cost of prescription drugs. There's food programs, as mentioned. And also, if somebody's kind of caught in a Medicare Advantage plan and they want to change it, there are periods of time in the new year where someone can leave a Medicare Advantage plan. It's a short period of time. I think it's January 1st to Valentine's Day. Someone can leave that plan. And then there's some special circumstances. Maybe somebody missed their Medicare enrollment period for Part B. So that is another instance where someone can call and we can help troubleshoot those issues.
That's great.
Yeah, and that's important because, the beneficiary, you're not going to know all of those different special enrollment periods or what's out there or what's available and, when you could enroll in something different. So again, contacting us, we have trained counselors. This is the training they go through to understand all of these different enrollment periods.
That is great. I'm really glad somebody asked this question. So the EPIC program is called the Elderly Pharmaceutical Insurance Coverage Program, and it was a mainstay here in New York prior to the drug benefit for lower income older adults to get assistance with their drugs. So can you talk a little bit about the EPIC program for those that may not know it or may not remember it and what its benefits can be?
The EPIC program is a great program. It's unlike some other pharmaceutical assistance programs in other states because in New York, what it does is it helps people pay their Medicare Part D premiums. And so it'll pay a monthly premium, and it also will lower the cost of drugs based on somebody's income. So if someone is around, $26,000 a year, they'll get some assistance paying their Part D premium. They'll pay a much more reasonable copays at the pharmacy. And then if their income is higher, they do have a deductible they have to meet, but then they can get some assistance where the cost of those drugs are lowered. But if we have anybody on this video Zoom right now that's listening, if you're enrolled in Epic, you might also be eligible for the Medicare Savings Program, which will lower your costs for your drugs even more. So even though you're on Epic, you should still be screened for the MSP.
Yeah.
Hey, Fred, do you know, or Heather, has the enrollment for Epic gone down over time because of the Part D? Because I think, what you were just saying about if you're in Epic right now, what the benefits are, you might be eligible for MSP. But there might be a lot of people who are listening that had no idea about the Epic program and the assistance it can help with that Part D premium, and also some of the other supports.
I believe the program enrollment is still going up in Epic, or is remaining pretty consistent. What is they're trying to do, the Epic program, is they're trying to promote the MSP to their enrollees, because they do realize how they can benefit from having that Part B premium put into their check. But Epic counts last year's income, the MSP counts the current month's income, so there's still a few misalignments that we're trying to work out. That's why we want people to proactively look into both benefits, because even if someone has MSP, they enroll into Epic. Epic gives some additional benefits, like being able to switch a plan, etc. So it's something for people to still consider.
Yeah, and Epic did, undertake their own initiative to help their enrollees, if they were not already in the Medicare Savings Program, to enroll. So if you're an Epic member and you're listening and you did receive something in the mail in regards to the Medicare Savings Program, give us a call and we can help explain that and work with you to get that accomplished.
That's great. And we have already put up the HIICAP number for people to call several times. Fred, how would people get in touch with the Medicare Rights Center?
They can call 1-800-333-4114. That's 1-800-333-4114. And since we partner so closely with HIICAP, calling HIICAP, we may be able to assist also, depending on the need in the county.
That is spectacular. Alex, do we have any other questions from the field? Okay, we do not. So I'm going to make a plea to anybody watching this today, but the real magic happens in the coming days, where we will get a lot of views. This is one of those. I think all of the shows that we do are important, or we wouldn't do them. This one is really, really important for the reasons that Heather and Fred have articulated over and over and over again. Please share this with anybody, friends, families, your own social media. If you're from an organization, like it, post it, send it out. Not only can people save, I think Fred talked about $2 billion back in your Social Security checks, but you have to have the right plan for you. Heather made that point over and over again, that everybody is different, and your circumstances need to be taken differently. And talk to one of our objective counselors through the HIICAP program or the Medicare Rights Center, so that that you can walk away with somebody working with you for what's best for you, not what's best for the insurance company. So again, I want to thank Heather. I want to thank Fred. You could see the passion and commitment, how important this work is. They're amazing human beings that just have continued to help millions and millions of people across New York State. Next week, we're going to be talking about pedestrian safety, but I'm going to get into a little bit more detail of what this actually is. And these are called walkability audits. Everybody has tried to cross a street that might be 2 lanes or 4 lanes, and you don't have enough time. And if maybe you're using a cane or when I pulled my hamstring, for example, you take your life into your own hands crossing the street. Those are unsafe streets. We've also seen downtowns now being revitalized differently, where they'll go from 2 lanes to 1 lane, or 4 lanes to 2 lanes, and much easier to walk around. So we're going to be joined by AARP, who is trying to do walkability audits throughout New York State. And we're simply going to be looking for volunteers. I'm going to be doing one in my community. with a checklist. It's very easy to do, so we can get that data on, safe streets, pedestrian safety, and what is walkable and what's not walkable, so that can be shared not only at the state level, but at the local level as people start planning different things. So again, want to thank Heather, want to thank Fred, as always, our communications team, Alex, Darren, Roger, make these productions incredible. Join us next week for our partnership with AARP to try to get some walkability audits. Open enrollment starts in 2 days. Please make the phone call. You guys have a great day, and we'll see you next week.
Live with Greg is a production of the New York State Office for the Aging Communications Bureau. Please join us next time.